Okay, I will give you just the hints. You should remember it. Okay, so without wasting anyone's time, we will start endocrinology. The most important disease of all, diabetes. Diabetes. It is the most common endocrine disease in India. Okay, most common endocrine disease in India. But if the examiner is going to ask most common endocrine disease overall, okay, most common endocrine disease overall means in the world, that is hypothyroidism. Okay, but it is not common in India. You should remember it. Now a biochemistry question. Diabetes क्यों होता है? There is problem with what? Insulin. Okay, इंसुलिन का प्रोडक्शन बंद होना या फिर इंसुलिन का रेजिस्टेंस आना. So a biochemistry question. Try to answer. Insulin antagonist enzymes. Anyone? पता है? Try to answer questions. Diabetes आना चाहिए? No one? Yes? Or? One more. Yes, correct. You can remember by the mnemonic ECG. That is epinephrine. C stand for cortisol, right? And G stand for growth hormone as well as glucagon. Okay, antagonist. So what they will do? They will do the opposite of insulin. Insulin does what? It decreases the blood sugar. So all these hormones are going to increase the blood sugar level. Okay, these hormones are going to increase the blood sugar level. Antagonist है इसके, right? चल. How many types of diabetes we have? We have two types, right? One is diabetes 1. Second one is diabetes 2. Can anybody tell what happens in diabetes 1? No one? It is a autoimmune disorder. क्या है? It is a autoimmune disorder. So what is going to happen? Yes. Beta cells of what? Beta cells of what? Thyroid or some other organ? 80% of beta cell will be damaged, right? So patient will have what? Low level of insulin. Low level of insulin. It is seen in diabetes 1. And in diabetes 2, what happens? Remember it. There will be insulin resistance. Okay. Body is producing insulins, but there is insulin resistance. The questions which can come, which gene is associated with diabetes 1? It is HLA, DR3 and DR4. Okay. HLA, yes. DR3 and DR4, correct. Okay. Now, what will be the symptoms? पेशेंट आ रहा है तुम्हारे पास डायबिटीज का, what are the symptoms that you will suspect this is the patient of diabetes? Anyone? Polyuria, polydipsia, weight loss, polyphagia, सुना होगा? Which of the following is not a classical symptom of diabetes? Which of the following is not a classical symptoms of diabetes? Confusion हो गया, right? Remember, it is not a classical symptom. Okay, not a classical symptoms. डायबिटीज का पेशेंट है इसका मतलब ये नहीं कि वो 24 घंटे खाते रहेगा, राइट? अदर सिम्टम्स और क्या होते हैं? इन्फेक्शन, राइट? इन्फेक्शन कौन से हो सकते हैं? यू हैव स्टडीड दिस इन्फेक्शन इन अदर सब्जेक्ट rather than the medicine. Black granulation discharge from the ear, that is malignant otitis externa or malignant otitis media. सुना है, right? Yes. See, if you are getting question diabetes related with the infection, most of the time question is from pseudomonas. Okay, most of the time question is from pseudomonas, ये याद रखना है. What is this? Blackish discoloration of, yes, skin part, right? That is called as mucormycosis. Okay, mucormycosis. And one more, the question which you get from the surgery, yes, it is diabetic ulcer or diabetic foot, right? Diabetic foot. Whenever you are going to get question on diabetic foot or diabetic ulcers, that patient has to control the sugar level as well. Okay, surgery में पढ़ाया होगा तुम्हें. They have to control the sugar level as well. Reason being, until unless the sugar level comes in control, that diabetic foot or diabetic ulcer is not going to heal. So diabetic foot or ulcer का question आया, in that management add control sugar level. Okay, control sugar level, right? क्या हो रहा था इन्फेक्शन के साथ? We are having diabetic foot or diabetic ulcer. Okay, चल, this was क्या था ये? This was symptoms which we will see in patient. Complications की बात हम नहीं कर रहे. What I am talking? I am talking about the symptoms. ठीक है, तुम्हें जो दूसरे पता है वो that are the complications, they are not the symptoms. How do we diagnose diabetes? Yes, HbA1c. HbA1c. How much months of sugar level will be diagnosed by HbA1c? Anyone? Yes, it is 3 months. आगे के या पीछे के? फ्यूचर और पास्ट? शुगर लेवल कब के? यस, मेन थिंग यू फॉरगॉट, दैट इज past 3 months. Okay, not of future, right? Then what we do? We do RBS, whenever patient comes to hospital or patient is on the insulin, so he have to calculate RBS every time before taking meal. Now एग्जाम में आएगा कि they are not going to write down HbA1c level. Okay, HbA1c level they will not write down, but what they will write down, more than 200 mg per deciliter. Okay, plus diabetic symptoms. Okay, so if कितने 200 के ऊपर है plus there are diabetic symptoms, we will consider this patient as a diabetic patient. Okay, if you are drinking tea also, sugar low level goes high, but you will not have a diabetic symptoms, right? So if diabetic symptoms are there plus glucose level more than 200, it is diabetes. Okay, so क्वेश्चन में यही आएगा, क्वेश्चन में यही आएगा, HbA1c नहीं लिखते मोस्ट ऑफ द टाइम, राइट? मोस्ट सेंसिटिव टेस्ट कौन सी होती है? एनीवन? It is fasting plasma glucose level. Okay, फास्टिंग प्लाज्मा ग्लूकोज लेवल, पेशेंट को हम फास्टिंग करने लगाएंगे ओवरनाइट, राइट? एंड देन वी विल कैलकुलेट द प्लाज्मा ग्लूकोज लेवल. Okay, that will be most sensitive test. How many hours should be fasting done? फास्टिंग कब तक होनी चाहिए? अराउंड हाउ मच टाइम? ओवरनाइट हम बोलते हैं, ठीक है, क्योंकि पेशेंट will not do around 12 hours of fasting, right? It is 8 hours. Okay, it is 8 hours, right? 8 hours. Question you would have seen, 2 hours oral glucose tolerance test, right? Question में देखा होगा तुमने, how many grams of glucose we will give patient to drink? Yes, it is 75 gram of glucose is given to drink. And how much glucose level should come to diagnose it? Anyone? No one? More than equal to 120 mg/dl. Okay, this should be the diagnostic criteria. Agar 5 grams of glucose we are giving and the glucose level is going more than 120 mg per deciliter, it is diabetes. Okay, then we come for the treatment. Now tell me the treatment of diabetes mellitus 1. What do we give to this patient? Anyone? Insulin. How do we going to give insulin? Yes, subcutaneous route. Timings? Every time patient is going to have meal, right? Yes, before food. That means every time before patient is going to have meal. How many times a patient has meal? Before breakfast, before lunch, before dinner, and one more. Before patient is going to sleep, that is in the night. which insulin will be given before night? नाइट में कौन सा देंगे? That will be regular insulin. Reason? It has more timing, right? वो लंबा एक्ट करता है. That's why we will give regular insulin in the night. Now यहाँ पर कौन सा देंगे हम? We will give ultra short acting. Reason being, patient is going to have food after this, right? So ultra short acting acts fastly, so they will control the sugar when patient is having food, right? कौन से होते हैं अल्ट्रा शॉर्ट एक्टिंग? Ultra short acting, yes, it is aspart, lispro, right? aspart and lispro. रेगुलर इंसुलिन कौन सा होता है? रेगुलर इंसुलिन ग्लार्जिन, डेग्लूडेक, and one more. Yes, it is detemir. Detemir. One more ultra short acting, because the names are same. It is glulicin. एस्पार्ट लिस्प्रो सबको याद होते हैं, ग्लूलिसिन आदमी भूल जाता है. Which one is the longest acting? Yes, it is the longest acting, 48 hours. Okay, it is the longest acting, right? If D is long, then only fun. So it is longest acting. But in the exam hall, and it is not used commonly, we use glargine. Okay, glargine ज़्यादा use करते हैं हम. So they will shift the option. Which of the following is the longest acting? Instead of giving deglutec and detamine, they will give glargine. Okay, glargine use किया जाता है इंजेक्शन लैंटस के नाम से. Okay, इंजेक्शन लैंटस. Okay, वर्ल्ड वाइड नेम यूज होता है लैंटस. नाम क्या है ब्रांड का? That is लैंटस. This was for diabetes mellitus 1. Now comes diabetes mellitus 2, which is the drug which we give commonly in diabetes mellitus 2. Yes, it is metformin. What does it does? क्या कराता है? It decreases insulin resistance. It decreases insulin resistance, right? What are the side effects that you need to know? Yes, and one more. It causes vitamin B12 deficiency. Okay, कौन सा एनीमिया? मेगालोब्लास्टिक एनीमिया. Megaloblastic anemia. Second side effect, which you all of you have marked correctly, that is lactic acidosis. Lactic acidosis, right? Yes, correct. Bioglitazone. Bioglitazone. What is this? बताओ. Bioglitazone का साइड इफेक्ट क्या है? Yes, one more. The main side effect. Yes, it increases the risk of bladder cancer. Yes, fluid retention, उसका मतलब क्या हुआ? फ्लूइड रिटेंशन हो रहा है बॉडी में. पेशेंट विल हैव congestive heart failure. Okay, congestive heart failure is the side effect. SGLT2 inhibitors कौन से हैं? Gliflozin, yes. DAPA, canagliflozin सुना है? Right, canagliflozin. तो side effect will be, yes, correct. Side effects are urinary tract infection or UTI होगा, and also it is going to cause UTI में एक है, that you need to remember, vaginosis, vaginal candidiasis. Okay, इसे याद रखना, vaginal candidiasis. Okay, then comes sulfonylureas. कौन से होते हैं? ग्लिमीप्राइड सुना है? ग्लिमीप्राइड. साइड इफेक्ट, anyone, what are the side effects? Side effects are weight gain. Yes, hypoglycemia, correct. Hypoglycemia. एक बचा है और. Which drug is remaining? DPP4 inhibitors. Gliptins, है ना? Gliptins, sitagliptin, yes, correct. And GLP1 analog कौन सा होता है? liraglutide, right? Liraglutide, correct. ठीक है. These are the drugs which we will give it in diabetes mellitus 2. Okay, mostly कौन सा यूज होता है? This is metformin, right? And SGLT2 inhibitors. Okay, metformin का एक और क्वेश्चन आ सकता है. Remember, it is a weight neutral drug. It is a weight neutral drug. Okay, this is the treatment. Now we come on complications. What is the main complication of diabetes mellitus? Anyone? That is diabetic ketoacidosis, right? Diabetic ketoacidosis, उसका मतलब क्या हुआ? Diabetes, K for ketone will be positive, right? And A stand for acidosis. Which acidosis? That will be metabolic acidosis, right? So pH will be acidic, right? This is the feature of diabetes ketoacidosis. Patient के symptoms क्या होंगे? Of course, blood vision, thirsty, high blood sugar level, right? सब कुछ उसका बड़ा होगा. one enzyme will be increased in diabetic ketoacidosis as well. कौन सा बढ़ता है? It can mimic something else as well. That is serum amylase. Okay, serum amylase level will be increased. Serum amylase. Thirsty का मतलब dehydration होता है ना, right? What is the management? Anyone? What is the management? First line is always going to stay. First line. It is IV fluids. Okay, IV fluids. और क्या क्या देंगे हम इसमें? Yes. IV fluids के साथ साथ we will give regular insulin. कैसे? That is IV. And if you can take a look over here, acidosis. Okay, so positive ions are increased in body, right? Positive ions are increased in body if you will do the ABG. So what will be decreased? That is negative ion. कौन सा होता है? Bicarbonate. Bicarbonate. So we will give soda bicarb to this patient. We will give soda bicarb to this patient. The reason, it will decrease the pH level. Okay, negative ion देंगे, so patient will have decrease in pH. Okay, this is the management of diabetic ketoacidosis. Same management will be followed, but there will be no ketone positive. कौन सा होता है? Symptoms almost same होंगे. Okay, symptoms will be almost same. कौन सा disease है? The name of the disease is complication actually. Hyperosmolar coma. Right? Yes. Over here, what will happen? The blood sugar level is increased. Okay. If you have used any time RBS random blood sugar का अगर तुमने RBS किसी का किया होगा तो sugar will be more than 400. Okay. As soon as patient sugar crosses 600 on the glucometer, what will be written? High. High glucose will be written. Okay. Hyperosmolar coma and diabetic ketoacidosis के symptoms same होते हैं. The only difference is ketone positivity. Okay, blurring of visions will be there. Same, everything will be same. Just ketone positivity will not be there. In diabetic ketoacidosis, patient's blood sugar can be normal. Okay, diabetic ketoacidosis में patient's blood sugar can be normal, but ketone will be positive. But in hyperosmolar coma, ketone will not be positive. That is the only difference, right? और कौन से complications है? एक तो मेन, दो हो गए मेन. देयर आर वन सम अदर कॉम्प्लिकेशंस एज वेल, राइट? ऑफ्थेल्मोपैथी किस में आता है? न्यूरोपैथी. दीज आर माइक्रो और मैक्रो. ओके, माइक्रोवास्कुलर कॉम्प्लिकेशन विल इंक्लूड आई, ब्लरिंग ऑफ विजन, राइट? किडनी में क्या होगा? पेन. पेन होगा स्टार्टिंग में, राइट? एंड पेशेंट कैन लीड टू डायबिटिक नेफ्रोपैथी, दैट इज माइक्रोवास्कुलर कॉम्प्लिकेशन. न्यूरोपैथी में क्या आएगा? tingling sensation in the hands, tingling sensation in the limbs, right? Numbness आ सकती है, and this patient can have गैंग्रीन, राइट? गैंग्रीन होता है डायबिटीज पेशेंट में। कौन से टाइप का गैंग्रीन होता है? पैथोलॉजी क्वेश्चंस। ड्राई और वेट? थिंक एंड ट्राई टू आंसर टिल द एंड, वरना मेरे को तो पता नहीं, राइट? ब्रेन में क्या हो सकता है? पेशेंट कैन हैव स्ट्रोक, ओके, TIA, हाई ब्लड शुगर लेवल, पेशेंट हैड स्ट्रोक, राइट? हार्ट में क्या होगा? MI। एक्सट्रीमिटीज पे क्या होता है? डायबिटिक फुट, राइट? डायबिटिक फुट मिलता है, यस। इट कैन ऑल्सो लीड टू गैंग्रीन। सो रिमेंबर, the organs which are small in size will have micro, which are big in size will have macro complications, right? Now tell me, ADH is produced by which part of pituitary gland? Which hormone is not produced in human or secreted? Easiest question, physiology. Easiest question. Remember, posterior pituitary gland has only two hormones. कैसा याद रखना है? Posterior pituitary has only two hormones, that is ADH and oxytocin. Okay, and there is one hormone named by melanocyte stimulating hormone. In humans, neither it is produced or secreted. Okay, okay. MSH नहीं होता है. Rest all the hormones. What I'm saying? Rest all the hormones is a part of anterior pituitary adenohypophysis. Okay, adenohypophysis. Mnemonic is there. If you want to use, you can use it. Okay, this is from the physiology book which I have edited, so you can use it. Then comes, कौन सी ग्लैंड है? Anyone? Zona glomerulosa, zona fasciculata and reticularis. Of course, it is a adrenal gland. Adrenal gland. Question comes in physiology. Zona glomerulosa produces what? Okay, how to remember? Remember it like this: GFR, AB, C, and D. Okay, aldosterone, C for what? Cortisol, and D for DHEA. Okay, androgen. Right, now take a look at this table and tell me which is the essential or necessary hormone to live. इसके बिना हम जी नहीं सकते. Everything is in front of you. Yes, many of you have answered cortisol, right? Many of you have answered cortisol, but cortisol का भी तो बाप है. Okay, cortisol का भी तो father is there. Hormone controlled by, right? So it is ACTH. ACTH is the hormone of necessity. Okay, it is necessary to live. Okay, ACTH के बिना हम जिंदा नहीं रह पाएंगे. Okay, ग्लूकोकॉर्टिकॉइड्स, कॉर्टिसोल जो भी बन रहा है बॉडी में, इट इज कंट्रोल्ड बाय ATCH. So this is the hormone of necessary to live. Okay, this is adrenal gland. कहाँ से क्या क्या secret होता है? Just remember all the steroidal hormones. Okay, corticoids will be secreted by adrenal gland, not by pituitary or thyroid. Thyroid gland will secrete thyroid hormones. Pituitary different hormones. Adrenal all the corticoids. Okay, all the corticoids. इंसुलिन कौन प्रोड्यूस करता है? डायबिटीज पढ़ा है ना हमने अभी. Okay, diabetes like features will come in which pancreas cancer? Or which cells is increased, or which hormone is increased from pancreas? If you remember the first slide, I said opposite action is of glucagon. So if glucagon is increased in the body, right? So patient will have diabetes like features, right? Opposite action है ना glucagon की, insulin के, right? Yes, correct. This is pancreas. Okay, all tables are important. Physiology में questions आते हैं, though it doesn't come out because these are one liners. Okay, these are one liners, so they do not come out. Everything is interconnected. Glucagon बढ़ा, insulin कम हुआ, diabetes like features, right? That you are going to study in surgery. Same ही होता है, right? I will not take this in detail. You need to study it. Okay, especially this diagram. They have removed this and they have asked which is the hormone over here which is going from testis to enter pituitary. Okay, so you should know it. ये आ चुका है, inhibin. Then comes acromegaly. Acromegaly क्या होता है इसमें? What does happen in acromegaly? Which hormone will be increased? Anyone? Yes, growth hormone will be increased. So how to remember acromegaly? Everything will be enlarged. Okay, everything will be enlarged. क्या क्या हो रहा है? Take a look. Widening in the mandible, right? Increase in interdental spaces. सब कुछ बढ़ेगा इसमें. Prominent eyebrow, right? Acral part में क्या होता है? Tarsal and metatarsal will be increased, right? Hypertrophy of soft tissue, that means increase in the cell size, increase in the cell size, right? क्या क्वेश्चन आता है? If after people is going to ask what is going to happen? Visual field changes, that is bitemporal hemianopia, right? Take a look over here in the image. Everything will be increased, right? Cardiomegaly, hepatomegaly, renomegaly. The size of the patient will be giant. Okay, giant दिखेगा इसके अंदर. And if we'll do the X-ray, what I'm saying, if we will do the X-ray, what is going to happen? This tissue size giant है ना, हाइपरट्रॉफी हुई है स्किन की, the tissue size of the heel will be increased. इसी को हम क्या बोलते हैं? heel pad sign. Heel pad sign, right? Heel pad sign. Treatment. What is the treatment for this? Anyone? Yes. First one is surgery if needed for anything. Then comes octreotide. Octreotide. Yes, it is a somatostatin analog. और क्या दे सकते हैं? Growth hormone is increased. So we can give something, yes, which is growth hormone inhibitor. Actually, it is growth hormone receptor inhibitor. कौन सा होता है? Yes, correct. It is pegvisomat. It is growth hormone receptor inhibitor. Okay, pegvisomat. Correct. Take a look over here. Fat pad sign. Fat pad sign. Poor wound healing. ऐसे आएगा क्वेश्चन. Moon face. Poor wound healing. Poor muscle development. And there are stria. There are stria on the abdomen. Okay. Poor wound healing. Red cheek and thin skin. क्या होता है ये? Yes, it is Cushing syndrome. Though I have given you the table from the book directly, but still features are pretty much clear. Moon shape, poor wound healing, right? And there are stria, लाल कलर के stria है abdomen पे, और इसको appearance बोलते हैं. Take a look over here. It is called as lemon on stick appearance. क्या बोलेंगे हम इसे? Lemon on stick appearance. ठीक है? Yes, correct. Lemon on stick appearance. क्या है ये? This is Cushing syndrome. Cushing syndrome. इसमें क्या होगा? The main portion of the body will be large, but the hand will be small. Right? इसी को बोले हम lemon on the stick. Acromegaly में क्या हो रहा है? Everything is going to increase. So patient will look like a giant. Okay, patient giant जैसा दिखेगा. But over here, the central part of the body will be large in the size, and the limb will be smaller. That is called as lemon on the stick appearance. Okay, yes, central obesity you can say. Okay, then examiner's favorite, men syndrome. Okay, men syndrome. Question will come all except men 1 is associated with except. Okay, men 1 is associated with except. How you will remember? Remember it like this. Pa, pa, P, parathyroid hyperplasia, pancreatic tumor, and pituitary adenoma. Okay, Pa, Me, Phi, parathyroid hyperplasia again, medullary thyroid cancer, and pheochromocytoma. Okay, and last one is Ma, Me, Phi, Marfanoid habitus, medullary thyroid cancer, and pheochromocytoma. Pheochromocytoma. Okay, Marfanoid habitus कैसे दिखेंगे? This is the mnemonic Marfan itself. मार्फनाइट हैबिटस, एक्टोपिया लेंटिस सुना है ना, एक्टोपिया लेंटिस सुना है. सो ओवर हियर द हिंट विल बी एक्टोपिया लेंटिस. लिखेंगे, एग्जाम में लिखना उनको जरूरी है, राइट. दिस इज द मोस्ट इंपॉर्टेंट टेबल. कैसे याद रखना है, बचपन में वी हैव यूज्ड, है ना, आ बे बे गे दे पढ़ते थे हम, सेम हो रहा है, पापा पी पा में फी माँ में फी. एक बार रिवाइज कर लो, एक बार लिख लो खुद से. गो एंड कैच द वर्ड, दैट्स इट. गो एंड कैच दिस वर्ड. आगे खुद वो लिखा होगा. दे आर नॉट गोइंग टू मेक द निमोनिक. फियोक्रोमोसाइटोमा. फियोक्रोमोसाइटोमा क्या होता है इसमें, व्हाट इज गोइंग टू हैपन, एनीवन लिखा है सामने. यस, कैटाकोलोमाइंस लेवल विल बी इंक्रीज. कैटाकोलोमाइन कौन से होते हैं, एड्रेनालिन, राइट. एड्रेनालिन लेवल विल बी इंक्रीज, है ना. सो इफ यू हैव स्टडी फार्मा, adrenaline causes what, it causes increase in everything, right. For example blood pressure. ब्लड प्रेशर बहुत बढ़ गया, यस, वेसो कंस्ट्रिक्शन, है ना. वेसो कंस्ट्रिक्शन होगा, बीपी विल बी इंक्रीज, राइट. हार्ट रेट विल बी इंक्रीज. तो ऐसा समझो कि योर बीपी इज इंक्रीज्ड. सो व्हाट विल हैपन इन योर बॉडी, राइट. हार्ट बीट्स क्या हो रहे हैं, बढ़ेंगे. हार्ट रेट इंक्रीज हो रहा है, हार्ट रेट विल बी इंक्रीज, सो देयर विल बी पाल्पिटेशन ऑन द योर हार्ट, राइट. हार्ट रेट बहुत इंक्रीज होगा, व्हाट विल हैपन इन योर हेड, आफ्टर सम टाइम यू विल हैव हेडेक, राइट. जब टेंशन आता है व्हाट हैपेंस, बीपी इंक्रीजेस, दैट्स व्हाई यू विल हैव हेडेक, राइट. स्वेटिंग आएंगे, यस. एंड इफ इट इज इंक्रीज सो वास्टली, बहुत बढ़ गया, समझ लो 200 के ऊपर चला गया हार्ट रेट, आफ्टर सम टाइम यू विल फील समथिंग इज हैपनिंग इन योर हैंड्स, हाथ कांपने लगेंगे, दैट इज कॉल्ड एज ट्रेमर्स. ओके, हाथ कैसे रखना है, adrenaline is increasing in your body, so everything will increase. That is the clinical feature of pheochromocytoma. हर चीज नहीं पढ़नी होती, हम पढ़ने जाते हैं और भूल जाते हैं. क्या इंक्रीज हो रहा है यहाँ पे, एड्रेनालिन लेवल, राइट, एडीआर. बाकी क्लिनिकल फीचर्स हमने पढ़े हैं, मैंने भी पढ़ा है एनेस्थेसिया में, फार्मा में भी पढ़ा है. सेम इज गोइंग टू हैपन इन pheochromocytoma. ठीक है, चल. एक आता है और पेशेंट is admitted in the ICU. Patient is known case of brain tumor. Okay. Now he is presenting with dilutional hyponatremia. His sodium level is going down. सब कुछ स्कैनर दे दिया. ICU patient, known case of brain tumor. His sodium level is not increasing. What is the probable diagnosis and what is the treatment? Repeat करूं. Patient is admitted in the ICU. Is known case of brain tumor. His sodium level is going down. चलो example, less than 125. बस क्वेश्चन फिनिश्ड. देखने की जरूरत नहीं, अगर उन्होंने लिख दिया his sodium level is going down, answer is clear. The answer will be what? SIADH, syndrome of inappropriate ADH, इसी को बोलते हैं. कहाँ मिलेगा? I just said it. Anyone try to answer? क्या बोला था मैंने अभी? In ICU patient. ICU patient. Okay. किसमें मोस्ट कॉमन कॉज, ब्रेन ट्यूमर. और क्यों मिलता है, squamous cell carcinoma of lung, or what do you think causes? Infection. Patient is in the ICU ना, that means patient is having sepsis, right? Sepsis है तभी ICU में बैठा है. And trauma, है ना? Head injury. Head injury के patient में भी we can have dilutional hyponatremia. Okay, decrease in sodium rapidly. What will be the treatment? Clinical features are written, still I will write down. Take a look over. Hypervolemia, उसका मतलब क्या हुआ? Increase in water reabsorption. हाइपोनाइट्रीमिया, इसी को हम बोलते हैं डाइल्यूशनल हाइपोनाइट्रीमिया, राइट? इनफैक्ट के जो पेशेंट आते हैं सीवीए, राइट? सीवीए के जो पेशेंट आते हैं उनमें ये मिलता है, कॉमनली सीन, राइट? इफ द patient is having less sodium, so treatment will be, of course we will give 3% normal saline. Okay, 3% normal saline, but how? We will give it slowly. कैसे देंगे हम? We will give it slowly, we will not going to give it fast. Reason? Yes, conivaptan and tolvaptans are given. If normal saline is given fastly, ये तो पता होगा, नहीं पता? सेरेब्रल पोंटाइन, आगे ये सेरेब्रल एडेमा, इसी को क्या बोलते हैं? माइलिनोसिस बोलेंगे. ओके, सेरेब्रल एडेमा करेक्ट है, उसी को बोलते हैं. ठीक है, सेरेब्रल पोंटाइन माइलिनोसिस. ओके, चलो याद रखना ये जो गंदे गंदे नाम है, मैन. ओके, कुशिंग्स एंड वो तो पीडिया वाले पूछते हैं मोस्टली. फियोक्रोमोसाइटोमा, SIDH are common topics. Anybody can ask. हाइपोथायराइडिज्म में क्या होगा? एवरीथिंग विल बी लेस. ओके, सब कुछ डिक्रीज होते जाएंगे. हाइपोथायराइडिज्म मोस्ट कॉमन कॉज, most common cause of hypothyroidism. Anyone? It is autoimmune. Okay, it runs in family, so it should be autoimmune, right? किसी को hypothyroidism है घर में, there are chances that after sometimes their children can have hypothyroidism, right? Drugs causing hypothyroidism, anyone? याद रखना है. यस, लिथियम बस एक ही है. अम्योडेरॉन एंड इंटरफेरॉन. कौन सा? इंटरफेरॉन अल्फा will also cause hypothyroidism. Okay, and pass also. Whenever you are going to get question on any kind of thyroidism, this is the table. This is the table that you need to know. अगर ये बताए, you will mark the questions correctly. कुछ भी clinical features दे दे. Okay, if TSH is normal, T3, T4, TSH increase, normal T3, T4, it will be going to be subclinical hypothyroidism. TSH is increase, T3, T4 decrease, primary. Okay, primary hypothyroidism यही मिलता है मोस्टली, राइट, यही मिलेगा, ठीक है. हाइपर में क्या होगा, थायराइड लेवल विल बी इंक्रीज, अपोजिट क्या होता है, टीएसएच लेवल विल बी डिक्रीज. टू डिक्रीज द T3, T4 लेवल, टीएसएच लेवल नीचे जाएंगे, राइट. नाउ एक और होता है Graves disease. What is going to happen in Graves disease? What will happen with T3 and T4? Opposite, that is, they are going to increase. Okay, so this is the table. If you know this, most of the time your answer will be correct. Okay, बाकी नहीं पढ़ा तो भी चलेगा इसमें. What happens in Graves disease? Anyone? Antibody against what? TSH receptor. Antibody against TSH receptor, right? Triad क्या है इसका? Classical triad. Dermopathy, ophthalmopathy, and yes, it is thyrotoxicosis. Okay, thyrotoxicosis. Okay, thyrotoxicosis. Best hint in exam hall, remember this. Patient will present with exophthalmos. किससे आएगा? Exophthalmos. Okay, and lead lag. ये दोनों पूछे जा चुके हैं from ophtha side. Okay, if we will give him a ice pack, okay, ice pack, and tell him to put it on the eye, what will happen? If you will tell him to put it on the eye, what will happen? Anyone? No one? It will decrease. Okay, it will decrease the size. Okay, it will decrease the size, right? Yes. Then comes Addison disease. Addison disease में क्या होता है? Which level will be decreased and which level will be increased? Okay, the level of glucocorticoid and mineralocorticoid is going to decrease, right? Glucocorticoid or mineralocorticoid is controlled by which hormone? The hormone which is necessary for living. Okay, that is ACTH. So ACTH level will be increased. What you are going to get? You are going to get hyperpigmentation. Okay, you are going to get hyperpigmentation everywhere. Okay, you will get hyperpigmentation everywhere, right? Now comes adrenal crisis. Adrenal crisis क्या होगा इसके अंदर? Again, everything will go down. Fever, सिंकोप, सिंकोप का मतलब होता है गिरना, ठीक है, सिंकोप आया, जीडियस, राइट. Patient can have tremors, convulsions, right? Hypoglycemia, hyponatremia, vomiting. This is called as adrenal crisis. ये भी पूछा जा चुका है, ठीक है. Treatment. What is going down? This is steroids. So what we will give? Steroids. Corticoids are steroids, ना? तो we will give steroids. कौन से देंगे? Examples. When you don't know the answer is prednisolone, right? और कौन सा होता है? हाइड्रोकॉर्टिसोन, सुना है ना, हाइड्रोकॉर्ट जिसे बोलते हैं हम, राइट. प्रेडनिसोलोन, हाइड्रोकॉर्टिसोन, यही दो दिए जाते हैं, राइट. वही तो एग्जांपल उसके. पेशेंट प्रेजेंटेड विद स्वेलिंग इन द नेक, ओके, एंड दिस स्वेलिंग मूव्स अप, ओके, ऑन डिग्लूटिनेशन. व्हाट इज द मीनिंग ऑफ डिग्लूटिनेशन? पानी पीने का नाटक करना, swallowing इन शॉर्ट, ठीक है, swallow करने पे, और like this, right? Yes, degglutination मतलब swallowing, and protrusion of tongue, tongue बाहर निकालने पे, right? This swelling moves, okay. इसी को हम क्या बोलते हैं? I will write down. Swelling moves on what? Degglutination. इसी को हम swallowing बोलते हैं, और on protrusion of tongue, protrusion of tongue, okay. क्या बोलते हैं इसे हम? What do we call it? It is called as thyroglossal cyst. बहुत बार पूछा जा चुका है. What is the treatment? ट्रीटमेंट क्या है इसकी? Anyone? सर्जरी पार्ट? यस, इसी को हम बोलते हैं सिस्टर ट्रंक ऑपरेशन, okay. Sister trunk operation. What do we do over here? What is removed? This cyst plus part of hyoid bone is removed, okay. Sister trunk operation इसी को बोलते हैं. Most common location of thyroglossal cyst. Anyone? Most common location of thyroglossal cyst is subhyoid. इसी को हम बोलेंगे infrahyoid, correct. Yes, okay. This is thyroglossal cyst. What is this? This has been asked. एक दो slide बचे, we will finish the class. It look like eye, okay. नाम है orphan eye. This image has been asked, okay. क्यों नाम दिया गया था? I don't know. It is seen in, yes, papillary cancer of thyroid. What do we get in papillary cancer of thyroid? Which type of calcification? पढ़ाया था कल, calcification. The calcification name is dystrophic calcification. Dystrophic calcification. It has been asked. Now, tell me which is the most common cancer of thyroid. and which has the best prognosis from thyroid cancer? Types कौन से remember it like this: papillary, right? और कौन सा होता है? Follicular, medullary cancer, lymphoma, और कौन सा होता है? Yes, anaplastic. Sorry. These are the types of thyroid cancer. Which cancer has best prognosis? Anyone? Yes, papillary, right? If papillary is not in the option, then if both are not in the option, then which has worst prognosis? Okay, if anaplastic is not in the option, then just remember, those who don't know, remember this mnemonic. Please, है ना, अपने 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 बंदो बंदी की जो फील करते हो ना, so feel this one also. Please feel my lean abs, है ना, which you don't have. Okay, please feel my lean abs. Remember this mnemonic. Most common to least common. Okay, best prognosis to worst prognosis. Okay, this is the sequence: most common to least common, best prognosis to least worst prognosis. This is the sequence of thyroid cancer. ये ऑप्शन में नहीं, ये होगा लीस्ट में. अगर वर्स्ट प्रोग्नोसिस में एनाप्लास्टिक नहीं, लिम्फोमा होगा. बोथ आर नॉट इन, देन मेडुलरी. ओके, दिस इज द सीक्वेंस. ठीक है, बेस्ट टू वर्स्ट, मोस्ट कॉमन टू लीस्ट कॉमन. रिमेंबर दिस निमोनिक, इट इज वेरी इजी टू रिमेंबर. एक बार तो याद रखना है. With this, we will finish the session. Okay, I told you this will be the short session, so we have finished in 1 hour or 5-10 minutes. Okay, read this once and please look at your physiology and medicine notes again. Okay, that is my humble request. Endocrine is important topic. Okay, with this we will end the session. Chale, thank you to all.